Welcome to the Resilient Performance Podcast. I'm your host, Doug Kachijian, and today I'm joined by Dr. Andy Morgan. Dr. Morgan received his medical degree from Loma University School of Medicine in 1986. He completed his residency training in psychiatry at Yale University in 1990. He then joined the Faculty of Medicine at Yale University and the National Center for Post-Traumatic Stress Disorder, where he worked for 25 years. Dr. Morgan has received grants and has published over 100 peer-reviewed scientific papers on learning, stress, PTSD, and performance in Special Operations Forces. Dr. Morgan served on the National Academy of Science Eyewitness Identification Committee from 2013 to 2014. For his work, Dr. Morgan was awarded the U.S. Army Award for Patriotic Service in 2008 and awarded the 2010 Sir Henry Wellcome Medal and Prize for his development of interventions to buffer the negative impact of stress on human cognition, memory, learning, and operational performance. Dr. Morgan served as an intelligence officer for the U.S. government and was a government advisor to the U.S. Intelligence Science Board. The products developed from his research have been vetted and validated domestically, as well as in a theater of operations. In addition to his work at Yale and the National Center for PTSD, Dr. Morgan has performed selection and assessment and operational psychology work for the U.S. Army and Navy for over 7 years. Dr. Morgan's work in national security with the University of New Haven is focused on intelligence analysis, national security psychology, and psychological operations. Dr. Morgan has conducted extensive research about how to appropriately measure and select military special operations candidates for relevant psychological characteristics. There's often a great deal of mysticism associated with psychological preparation in this population, and Dr. Morgan clearly defines the qualities that matter and how they can be reliably measured. He's clear to point out that his research is not necessarily generalizable to other populations. In other words, context is crucial in screening for psychological attributes. His systematic approach to talent development and psychological preparation is generalizable to any population, however. Despite his substantial knowledge and expertise, Dr. Morgan opines with a humility that should serve as a platform for further conversation. Dr. Morgan, thank you so much for taking the time to join us on the podcast. I wanted to begin by talking a little bit about your research. So I know that you've done quite a bit of work with the military special operations community, particularly with regard to the psychological characteristics that help to define this population. I was wondering if you could start by maybe talking about what psychological traits you found to be important in this population, and then how you would operationally define and objectively measure these traits, because a lot of times military special operations personnel are associated with this abstract term mental toughness, which kind of can become this umbrella for all the different psychological characteristics that help characterize this population. But I find it problematic because, again, it's this abstract thing that no one's actually defined. And in your research, you've actually kind of broken that concept down into more constituent and measurable parts. So could you go ahead and talk about, again, how you would operationally define some of those characteristics and then how you measure them?
Sure. Yeah, before I describe them, I'd say most of what I know about those characteristics are from studying mainly men who are attempting to enter a special operations community or who are in the special operations community. And I would agree with you in the sense that I don't know to what degree these traits have general applicability across different fields, but we know for sure that these traits contribute to success in this particular community. So if it inspires someone to actually compare these traits in different communities and do their own research, that would be really fantastic. The thing that we found years ago was that people, when they showed up at selection, who seemed to fill out questionnaires expressing some sense of vulnerability, had a disadvantage in succeeding in selection. And over time, we've looked at a range of things, how people view themselves, other people, how they view making mistakes or failure, their ability to regulate their emotions, their ability to identify what is a threat. And taken together, what we find is that the biggest factors that stand out that make these guys resilient, and I can get back to that, what I mean by that, is that they have a very positive attitude and a singularity of purpose. They know what they want, why they want to be there, and that they are willing to give their all to try and attain that goal. They're optimistic. They actually believe they can succeed, and they see failure as a learning opportunity. A failure is not, when they fail at something, it's not a statement about them. They don't say, well, I failed at that, therefore I'm a weak person, I'm a bad person, there's something wrong with me, I have deficits. They may frame it as, well, I have a hole in my education, so I'm going to fix that. They see it as an opportunity to self-improve and then tackle the environment once again. So it doesn't get them down, it motivates them to try harder. With respect to another factor, they have a very high ability to regulate emotions, which is probably why some people who are married to them accuse them of not having any feelings or being kind of too cold and say, that's very cold and cruel of you. How can you say those things to people? They can be very blunt. In one sense, I'm a Star Trek fan. So if you think of Mr. Spock, who runs by logic, sometimes they can sound like that. But in fact, they're full of a wide range of emotions. You can see that when they work with a team. But when it comes to identifying a problem and wanting to fix it, they see it in the cold light of day, and they're not hot-headed. They don't have thin skin. Things don't get under their skin and bother them very easily. And in the psychological testing we do, we call that neuroticism, how prone a person is to feeling anxious, feeling angry, feeling hostile, worrying. Some people call it the Woody Allen factor. Am I good enough, smart enough? What do people think? They're very low in that. As a matter of fact, as a group, they're probably 99% of the population is more neurotic than they are. So they are not run by emotions. They run by their purpose, their goal, the logic of how to get there and how to attain that goal. Then, as I referred to when I mentioned the thing about failure, rather than seeing it as something about themselves, they see it as a helpful form of feedback, and they interpret any setback as just temporary. It's changeable. It's going to go away quickly. This is one situation. I can do something about it, or if I just wait, it'll pass, and then I can proceed. So, with respect to threat, with respect to danger, they have an attitude of moving at a threat rather than avoiding it. And we can talk a little bit about some of the physiology, the ways that we measure that. But their perspective is not threat avoidant. It's to go at a threat, to deal with it or eliminate it.
Okay, and then I think that segues nicely into the next thing I wanted to ask you. So you've actually done quite a bit of research about the concept of dissociation. So can you elaborate a little bit on that, and then how the soft population either exemplifies this concept or it doesn't?
Sure. Dissociation is rather a fancy term, but refers to the experience of mentally separating from the environment in a sense that the world around you may look different, sound different, and feel different. Some people call it the Alice in Wonderland effect. In other words, you may feel that your arms and legs are longer or shorter than they really are. The world may look like you're viewing it through a wide-angle lens or through tunnel vision. People who make horror movies try and give you that sense, when you're zooming in at something and the whole world's receding behind the horrible thing that's coming at you on the screen. So it refers to a distortion in how you see things, feel things, sensory-wise, and how you may perceive your own body. In the mental health literature, dissociation, or this mental disconnection from the world around you, has been widely associated with traumatic stress disorders, that people under high stress, whether it was children being abused or women being assaulted or men under combat situations, people have described these symptoms under extreme states of stress. And in my field, in mental health, I'm a psychiatrist, we've thought about those as being quite protective for a victim that can't do anything. They can just mentally disconnect and not be as in tune with the horrible things that are happening to them at the time if they happen to be being sexually assaulted or physically assaulted. In the animal literature, we see animals under stress that freeze. And right now our assumption is that freezing behavior in non-human animals and dissociation in the human animal are somewhat related. They're not exactly the same. And, unfortunately, the rats just don't tell us what they think in the lab, so we can't tell. But we do think, for a number of neurobiological reasons, that those experiences are very similar. Anyway, in my field, we thought it was a sign of pathology. And in the previous edition of the DSM, the Diagnostic and Statistical Manual for Diagnosing Mental Disorders, we had a category called acute stress disorder that really had this idea that people exposed to acute stress may have these symptoms, and the people who had more of them were at higher risk for getting post-traumatic stress disorder. Didn't quite turn out to be true, and at the same time, I was down at Fort Bragg studying men going through survival school, quite a rigorous form of training where people experience high degrees of stress. And I was finding that everyone would experience symptoms of dissociation while they were in mock captivity, experiencing mock interrogations, waterboarding, light, and things like that. And since everybody had it, we realized pretty quickly it couldn't be a marker for psychopathology. It would be like saying everybody breathes, therefore they're ill. Everybody has dissociation, therefore they're ill. They're not ill. And so we began to look at that, and we found that there was variability in the degrees to which people dissociated. And that turned out to be a predictor of how well people did in those environments under stress. And then when we looked at it in selection and assessment environments, when people show up at the starting gate to try and get into the Special Forces community or the Special Operations community, now a number of them, we found that people who have a propensity to dissociate don't pass at the same rates. And we think that's because in these selection programs, the person is challenged all along the way to interact with their environment and problem solve and respond to an ever-changing situation in order to show people they can think on their feet, they can adapt in ambiguous situations. And that if you dissociate, you're mentally leaving the scene, and so you're at a disadvantage to someone who's not as mentally disconnected. So whether it's land navigation at night or whether it's underwater navigation when they're in dive school, people who are mental drifters are off the mark, so they lose points. We've seen this is true in military personnel who fly aircraft that have to, if they're tree skimmers, if they have to do some sort of special operations flying, the mental drifters don't do as well. So it kind of makes sense. Our one caveat to that is with the SEAL community, they're unusual, and there's a bimodal distribution. In other words, about half the group really endorses a propensity to dissociate, and the other half doesn't endorse a high propensity at all and look a lot like the Green Beret units and other units. And yet the group that is dissociating in the SEAL community, by and large, are doing well under stress. And we think that one of the explanations may be the experience they go through at BUDS, where there are events during the BUDS course and selection that just require people to deal with adversity, sort of sit in cold water or deal with a physical situation they can't do much about. And so that perhaps mentally disconnecting helps guys stay in the game and not quit. Whereas in the other selection programs, there's not many of those events at all, and they're really being rated much more dynamically on interacting with the environment. So that may explain the one anomaly that we have in the finding. But in general, we find over and over that dissociation is not a good thing if you're supposed to be interacting with the environment. And it does link to differences in neurobiology and chemistry as well.
That's really interesting, and I guess it makes sense. So, and correct me if I'm wrong, I'm trying to reframe what you're saying. So when people have to actually solve problems, it's maladaptive to dissociate yourself from that situation. So would it be accurate to say that what you're looking for in the soft operator from a dissociation standpoint would kind of be more like what we normally refer to as focus in the normal vernacular?
That would be correct. We're looking for people who don't do very much of it, and for people who, when they're under stress, they really are able to focus and regulate that. The people who can't don't do well. That's correct. Okay. And then switching gears a little bit from the psychological to the physiological, even though it's kind of a spectrum and really more the same thing, two sides of the same coin. You've done quite a bit of research on stress hormones and heart rate variability in this population during some of these selection courses. So if I could summarize the research, it seems that you've identified a couple of key biomarkers, mainly Neuropeptide Y and DHEA. And if I'm not mistaken, the conclusion that you drew was that
higher baseline levels of these markers are suggestive of a more optimal stress response. So if you're in one of these programs and you know that you're about to undergo a stressful situation, obviously the stress response is good because it's going to heighten your awareness, improve reflexes to a degree. But I guess some people who might have like an overly sympathetic response that would border more along like an anxiety attack, those people aren't going to do well. So these biomarkers, neuropeptide Y and DHEA, seem to attenuate the stress response so that people don't take it too far. Is that kind of the right way of summarizing it?
Yeah, I think in general, you're dead on. So our stress response, a lot of people may think about it as a sympathetic nervous system response, and we also have our hypothalamic pituitary adrenal axis. So we release glucocorticoids like cortisol. Animals release corticosterone. And then we release, of course, norepinephrine and epinephrine. And it's meant to help us. So when we're under an acute threat, non-human and human mammals have this response, and it's meant to be adaptive. It mobilizes glucose. It gets energy to the areas of your body you need it for your big muscle groups. There's no time to feed and breed, so it tends to shut down gonadotropins and shunts blood away from your gut, out to your big muscle groups. So we think that under stress, that's highly adaptive. However, under high states of stress, we also know that glucocorticoids can be harmful to certain areas of your brain, like the hippocampus, where we're doing certain kinds of memory formation and spatial memory and a number of other things. And so as stress gets extended, we know that can be quite damaging to certain areas of the brain and maladaptive. And the thing that we noticed when we started looking at the guys at SEER School were that they had beautiful stress responses in that venue. It was a great place to look at acute stress in humans. But we did find that some people thought more clearly under stress than others. Some people could problem solve better than others. And neurobiologically, you are correct. The ones who seemed to be thinking the most clearly under stress were people who had more neuropeptide Y, and others who also had more DHEA. They weren't always the same people, which suggests there may be multiple ways of doing well under stress, but by and large, over time, the NPY data, the neuropeptide Y data, has really held up as explaining a number of reasons why animals and humans do better under stress. So neuropeptide Y, it's a peptide. It's made in neurons and it looks like a Y, so hence the name. But what it does is really interesting. It is manufactured in cells that also make norepinephrine, and there are dense concentrations of it in certain areas of your brain. It does a lot of things all over your body, but we're interested in what goes on in your brain, near and around your fear and alarm centers. And when people release lots of norepinephrine, and if they have a high capacity for releasing neuropeptide Y, it seems to attenuate or mitigate the negative impact of too much norepinephrine, and keeps your prefrontal cortex working. So when you grab your forehead and you go, oh God, what was I thinking? You're grabbing that front part of your head, right? That forebrain, that thing that makes us different than lots of other animals on the planet, tends to shut down under high states of arousal, under high states of adrenaline. It's as if your brain says, there's no time to really think and meditate over things. It's time to react in the way I've habitually learned to behave. And so under high stress, most critical thinking goes away. But people who have more NPY preserve more of their frontal lobe functioning. And we find that patients who suffer from anxiety disorders, like in post-traumatic stress, they don't have as high capacity for release of NPY, and their frontal lobes shut down much faster under high states of adrenaline than people who don't have PTSD, and much faster than people who have high capacity for neuropeptide Y. We have a bit of a debate going on about how you get to be a high capacity NPY person. It's probably picking the right grandparents. We know there's different versions of the gene, and that some versions of the gene, when you're under stress, result in less of a production for NPY, and others result in a greater production of NPY. So we suspect that the reason why when we look in selection and we measure neuropeptide Y at the beginning of a selection program and look at someone's neuropeptide Y capacity, their capacity to go from baseline to releasing some under stress and coming back to their baseline level, the people who have a greater capacity do much better in selection, and you can make predictions that are far better than chance at seeing who will be successful. And it's probably a function of it keeps their brain much more online and intact to do problem solving, and so they thrive in that environment. As stress goes up, they're able to thrive. I always joke with other people, and I say no one gets more creative under stress. Really, we all get stupid, but some people get stupid faster. So I think other people look brilliant because my brain just fell out sooner than theirs did. If you think of it that way, the people who are high NPY capacity people, they have more intact brain functioning going on longer than maybe the rest of us do under high stress. So that is one reason why we know some people are more successful than others. And we do think that having more MPY helps people be resilient in the sense that they also have less anxiety. It attenuates anxiety. As a matter of fact, one of my former bosses, Dennis Charney, who's down at Mount Sinai, is doing experiments looking at whether or not you can give NPY to people who suffer from anxiety disorders to ameliorate their condition. So it's a really interesting peptide, and we think it tells us a lot about how our brains function and cope with stress. The other one you mentioned, DHEA, is sold in health food stores. It's sort of the mother steroid of your body. Everybody makes a lot of it up to their 20s, and then for some reason every decade after that, most of us don't make very much of it. And so lots of people buy it. I think in the lay audiences, sort of regular civilians may buy DHEA in the health food store because it enhances libido. It's a mild antidepressant. It helps people tolerate stress. But in the biological sciences, what we found in stress studies, whereas people who were working with non-human animals noticed that DHEA and a different form of it, DHEAS, it's solvated and it's around a little longer in your body, are highly protective of those areas of your brain that I mentioned earlier, like the hippocampus, and protect those areas from being damaged by high doses of glucocorticoids or like cortisol. So people who have more DHEA actually have this protective element going on that keeps their stress response hormones that they need to respond really well, keeps those responses from producing negative effects on areas of the brain where they need to do spatial memory, spatial orientation memory, to remember word lists, to process memory very quickly. They do much better in selection programs if they have more DHEA, and they also do better at underwater navigation at night down at dive school, which is the same as we see in non-human mammals. Little mice, when you put them in a water maze and make them swim, and they're stressed, and the ones that have more DHEA find the little platform that they need to stand on so they don't drown much faster. So a little less is known about why and how people differ in DHEA. Some of it's, again, probably genetic, but we do know that how you're raised can have a profound influence on many of these things like MPY and DHEA. We just don't understand the mechanisms yet. So it's probably a nature-nurture dynamic that we're waiting to unfold. But what we do know for sure is that having more of it helps. I think right now there's still an open question as to whether or not we can give DHEA to active duty people to see if it would enhance performance. And there's a couple of reasons for that. In the soft community, they're already making so much of it. It's unlikely giving them more of it may make much of a difference. But I think it would probably be useful to see whether or not the military would do studies to see if the administration of DHEA might protect men and women now going into high stress or repeated stress environments, so that it might actually attenuate the development of anxiety and stress disorders for that. But in the soft community, the Special Operations Forces community, rates of PTSD are very, very low. They're down in the 1% to 2% range, even though they see a lot more trauma than most general troop forces. And we think that some of that is selection, getting people who are low in neuroticism, they're high in NPY, they're high in DHEA, and they're differentially advantaged, I think, to deal with that kind of environment and not have as many psychological issues from the work that they do.
Yeah, and then so when you're talking about like higher baseline levels of these biomarkers, are you talking about like when they're close enough to the stressful event actually occurring that they can anticipate it, or would these guys even have higher levels of these biomarkers, like if they were on a week-long vacation and sitting on the beach? Is it like just higher across the board, or is it when they're close to the actual stressful event, or both?
It's a little bit of both. For DHEA, we measured that 5 weeks before people were tested in their culminating exercise, and also at SEER school. It's just the starting level of DHEA, and even at rest, they have more of it when they're not in stressful circumstances. With respect to NPY, it's slightly different. They may look their levels of circulating NPY may look just like yours or mine, but when they're then challenged, they release probably more than a third more, almost twice as much as the rest of us might release. And then when the stress is over, they come back to their baseline, whereas lots of people drop below where they started. In other words, we've all become slightly depleted and we have to build it back up. So for DHEA, yes, it seems to be that they look different even when nothing else is going on. With Neuropeptide Y, the differences are seen when you challenge them, when you put them under stress, and when you assess them when the stress is done. They've bounced back to their baseline, and most people have not. They're now trying to replenish what they used. So that's why I refer to, when I talk about NPY, I generally say it's a greater capacity for NPY release, rather than just having a raw baseline difference score. Does that make sense?
Yeah, it does make sense. And then I wanted to reconcile some of the heart rate variability research you've done, because in the sports science world where I'm working now, I think that people tend to oversimplify the HRV or heart rate variability message, where they'll say more heart rate variability is always better, because typically in the world of sport, people are using HRV kind of as a non-invasive way to measure recovery and to measure that parasympathetic, sympathetic, autonomic balance. But you found, and correct me if I'm wrong, that in your research, prior to some of these stressful events like those that occurred at SEER school, the people who did better tended to have lower heart rate variability, which kind of makes sense because it suggests that they're having an appropriate stress response. You want to be a little bit sympathetic before some of these events. And I think you even might have said that it was associated with better ability to target discriminate in some of these shoot, no shoot scenarios. So my question is, I guess with regard to HRV, acutely, what are we looking for? And then chronically or long-term, what are we looking for? Because it makes sense that in an acute stress scenario, you'd want lower HRV. But if these guys are going out night after night doing multiple missions, say on a deployment, is there a point where having that reduced HRV every night, that appropriate stress response, without adequate recovery could be problematic?
Yes. HRV has been really popular, and I think probably one of the biggest misconceptions about it is that it measures one thing, that it's just telling you, this reflecting one process that's going on in the body. So people tend to look at the different HRV data and then they get confused because sometimes it's up, sometimes it's down, and they're not sure what to do with it. Whereas I think it's for what I was interested in doing, I was interested in a specific component of heart rate variability. So I'm assuming people know what it is, but we're looking at the spaces, the timing between heartbeats. And heartbeat intervals vary. And if you look at the ones that vary between 100 and 400 milliseconds and then look at the standard deviation of that, or you can use many different approaches, you're really indexing the activity of the vagus nerve. So for me, heart rate variability was a poor man's way of trying to index what's going on in the central nervous system, trying to see what's going on under stress. And in a particular area of the brainstem, the nucleus ambiguus, there are high concentrations of neuropeptide Y, and that has a direct impact downrange on the sinoatrial node of the heart. So I was working through how to find a cheaper way to look at people who do and don't have a high capacity for NPY release by looking at a component of HRV, because it's very expensive to measure the hormones. And you are correct. When we measured HRV both at SEER school, at dive school, and another number of other venues, we were surprised to see that even day one, or a week before at SEER or day one at dive school, that the people with low heart rate variability, specifically we're looking at the high frequency domain. We did look at low frequency, but we were really interested in the high frequency domain of it. People who had low heart rate variability did better. And it was a predictor of doing better, thinking more clearly under stress, navigating underwater better, problem solving better on different neuropsych tasks, and having better memory on some items. And we were perplexed because in medicine and in the sports field, low heart rate variability had been paired with, fetal distress syndrome, people having cardiovascular disease, and yet at the same time, putting it in context, you made a comment that I think is absolutely dead on. These guys were all waiting to get in the game and become a combat diver, or get through survival school or get through selection, and I think that, or waiting to go through close quarters battle or shoot house stuff, CQB. They're waiting for the bell to ring and then run in the shoot house and hit the right targets. And low heart rate variability to us then began to suggest that they're in it. They're in their zone. They're not mentally ruminating, whereas the ones who had high heart rate variability were our anxious ruminators, kind of pulling into their head, pulling back out, kind of, and their heart then would be speeding up, slowing down, speeding up, slowing down. One way of thinking about it is in that way, that the anxious people have higher heart rate variability under the stressful circumstances than the ones who are cool and ready to operate. So if you think about that in the sports world, that may translate to an athlete that's just in the zone and no longer playing head games right before the bell rings and the race begins. At rest, they have wonderful heart rate variability. It's actually quite high. I've been able to test them in environments when they haven't been under stress, and their heart rate variability is the same as the rest of us, if not slightly higher, depending on which special club we looked at. But under stress, it's low, and that seems to be adaptive. And but we were perplexed early on when we got the data, and we said, well, I don't know, maybe having low heart rate variability, if it's really chronic for them, means you play a good game, in the soft community, but it doesn't mean you live very long when you leave it, right? Maybe it does put them at risk for heart disease. We no longer think that that's entirely true, since we've seen normal heart rate variability at rest with these guys. But early on, that's what we wondered. We said, well, you can play a great game of football and have bad knees at 40. Remember, selection and selection programs are designed to let through all the wickets the person who's the best fit for the work involved on the job. So there's no prediction about what will make you great at age 60, right? Or when you get out of the military. The kinds of things that people are drawing on are the things they think that will make you really good in the operational community for hunting down bad people and killing them, or, engaging in particular kinds of special operations activities.
Yeah, that's really interesting. And I think it leads to the next thing I want to talk about, which is the issue of transfer. So using the sporting analogy, this is like the multi-million-dollar question where you look at things like the NFL Combine, where they'll do all these tests that don't have a whole lot to do with football, and then if you're an owner or a general manager of a team, you're using that information to invest a lot of money and time into developing these players, when obviously those tasks will never transfer as well to the actual game itself. Sometimes I feel like people, because watching the game involves some subjectivity, they say, well, that's not really good enough. Let's try to find these tests that indirectly measure what it is that we can observe directly, even though that complex scenario, which is playing a football game or being an operator on target, is much harder to measure. So we have this kind of reductionist way of breaking it down into pieces that we hope adds up to the real thing. So in the soft world, I mean, the ideal way to select people would be to put them into the kind of situations they're going to encounter downrange, i.e. shoot at them and see how they react. Now, there's obviously a lot of issues with that, ethically and from a resource allocation standpoint, and pragmatically, because you're trying to select people who haven't been trained yet, and you don't want to invest all that time and money into training people unless you think they possess the physical and psychological characteristics that will allow them to get through training, right? So you're not just going to throw somebody out of a plane or train someone to jump out of a plane that might not make it through the CQB portion later on. So I guess what I'm asking is, when you're designing these selection programs, how do we bridge that gap, and in sort of an indirect way, what things should we be looking at that are going to have the most carryover to operational performance, which is something that's very hard to simulate in untrained people?
Well, yeah. So for me, you've touched on a number of things that sort of get me excited, and I probably will annoy some people with what I have to say. But I think my observation is that for the sports world, especially if it's competitive sports where a lot of money is made, like football, basketball, baseball, there is a trend for people to rush out and grab the latest psych test, and they'll say, well, they used it in the military, therefore this is going to give us, the people we want, or the latest neurobiological test or psychophysiologic test. And there's lots of people marketing it. And I think the thing that, where I probably disagree with that is, I think many people move too far beyond their data. I know what I have found does apply to the soft community, or at least to many portions of the soft community. I've never done any studies of submariners, so guys who might live on a sub for 6 months to a year. And I know I've worked with a colleague who has done selection for them, and they look very different than some of the guys that I study. Not to say they're not resilient, but they don't even have to talk to people for great periods of time. Whereas some of the guys in the SF community, they have to. They're selected to be social and work with indigenous populations. And anyway, so I've seen this trend where people rush out and they say if the military used it, it therefore must be good either for sport or business or something. And I don't know. They might get lucky and find something, but I think it's a very bad way. I think it's a very poor or ineffective way of doing science and unpacking it. My experience is limited with the professional sports world, but I have been fortunate to get to know and work with some people in both baseball and in football. And I know that in those environments, there's a long tradition of the scouts identifying people and identifying what they see. And there is somewhat of an analogy of looking at cadre who do selection and assessment, but I think there's more variability. I don't know if it's well understood, and I'm not disparaging the scouts' judgment. I think that we have a great deal to understand about what it is they see and how predictive those judgments may be, taking a lot of factors into account. And if I had a recommendation for the sports world, I'd say they need to do something systematically and think about what are the elements of the game, and given the different numbers of players and their job, what are the principal components? What are the primary factors that reasonably account for why a person does well or not in that role? So whether someone is a defensive lineman versus being a quarterback versus being a kicker versus being a pitcher, looking at those different roles, I would argue that you may have a different test for predicting who is going to be better when you're selecting quarterbacks or pitchers than some of the other roles that people play. I think it would be true for many different sports. I think there's other than being physically fit, and being motivated, that basic component of being conscientious enough to train regularly and learn your art and your craft. I think that the predictors of those may be slightly different, that you might use slightly different tests. But people tend to want to use a cookie cutter approach and just say, well, the military used it, we're just going to do that. So we are playing around with one form of psychophysiologic testing called threat attention bias, which is how rapidly a person's brain can identify a threat and respond to it. It operates right at the threshold of consciousness. So if you blink, you miss the cues on the computer screen. And it's really tapping into two different components, the processing of information speed in your brain, and then your ability to react. We're pretty convinced the ability to react, it can be improved by training. We're not sure whether the innate processing speed of information can be altered by training. I think that's going to be an empirical question to answer. But people vary in that processing speed. And we think that variance does account for why and how in some of the soft community, why and how people perform better on memory tasks and in shoot tasks in CQB. It is possible that kind of testing might be very useful at sorting out why and how people perform differently at the plate when you've got a ball coming at you at 90 to 100 miles an hour, or in a game in recognizing a wide field of play. But I think those are empirical questions to ask and say, look, it's reasonable to speculate that there might be something similar to the shoot don't shoot task, hitting the right target, and a pitcher putting the ball where it's supposed to go, over the plate where he wants it, or maybe responding to the ball coming at you. But I think that what would really help the sports world is if they had a systematic way of assessing and not changing their mind every 2 years. I mean, some of the things you'd have to do at the combine is test a lot of people, whether you've hired them or not, whether you've drafted them or picked them or not, and looking at how they play over the next 3 or 4 years. Because you may find that there is a clubhouse effect, that people with the same performance on some of these measures, they thrive in some clubhouses and not others, and that their performance is varied. That would be encouraging to know that it's coaching and training. We may find that if we did it and let it ride, that people who are just better in this threat responding, they tend to thrive no matter where you put them. Sort of like thinking about, cyclists. Some have a greater aerobic exchange capacity than the rest of us. They're all abnormal, really. But, some of them, it's, picking the right grandparents and having a better ability to move oxygen, across the barrier there. But I think that remains to be seen. And so I've been a little discouraged by the haphazard approach that I've seen many people take, and then the lack of follow through. But I think if they think carefully about the roles that people play and which kinds of tests tap into the core components of that test, then they probably could apply some of the things that the military has done so well in selection. I mean, the military has done an awesome job at thinking about what they need a person to do downrange, and then setting up, the gates or the wickets in a selection program to ensure that they have a lot of what they need at the other end.
It's really refreshing to hear a psychiatrist say that, because a lot of times, you'll see these kind of fake buds experiences being marketed to professional or collegiate sports teams or even corporations. And the idea is like, if you go through this like 1 or 2 day buds experience, that's going to be this panacea and make you mentally tough or whatever other sort of pseudo name they've constructed. But so the idea is that these psychological characteristics are very context specific, and just enduring physical punishment, which is funny because people, outside of the military consider that training. But in the military, it just uses selection. There's no other scenario where you're going to walk around, crawl through mud for a couple of days and walk around with boats over your head with no sleep. Like, you're doing that to weed people out so that you can train them later on. And yet other organizations are taking these practices out of context and using them for training and not selection. So, like I said, it's great to hear you say that. And then going back to just some of the research that you've done, because we talked a couple of days ago setting this up, and you said some things that I thought were really profound about trying to balance the objective with the subjective. So you were saying that the things that you're measuring are really just correlates for performance, whether it's neuropeptide Y or DHEA. You're not measuring performance directly. So it's kind of like in the world of sport, looking at an endurance athlete for things like aerobic enzyme function and VO2 max. People who are elite endurance athletes are going to have higher levels of those biomarkers, but that you're not getting gold medals for having the highest VO2 max. There's probably a threshold where you need a certain VO2 max or aerobic enzyme level to be good at what you do. But until you're willing to say in a military selection scenario, unless you have X level of neuropeptide Y or DHEA, we're not even going to let you try out, which we're not. It's really just a way to collaborate with other forms of data, including the subjective impressions of the cadre. So you were saying that you actually put a lot of stock in what the experienced cadre members say. And what you're ultimately trying to do is to look for a disconnect between what the cadre members are saying and what your objective data is finding. And that's where you guys have the conversations. But most of the time, and if you have the right process, which is what you're emphasizing, the subjective and the objective should kind of mirror one another. So can you just elaborate on that a little bit?
Yeah, I was often allowed in to study different soft units and in special programs, and then discover that, the commander usually had a very meaningful question. You want to know, how do I get more people, and are my cadre being inappropriately selective? Like, are they just picking too few people? Are they just picking people they like? Are they being capricious in some way? And the long and short of it is, in every program that I've studied, I go back and I brief the command and I tell them, if I'm able to predict using baseline measures who is going to be successful better than chance, and it's matching the cadre judgments, I know that they're not doing things in a random way. Now, I might not know that they're just not still picking a narrow range of people who could succeed. But the thing that gives me much more confidence in them is that the findings that I have also match the non-human data from animals being studied in the lab. So that we know from the lab that having more NPY, having differences in heart rate variability, having more DHEA makes those animals thrive and perform well under stress. And we've seen that now in the humans going through these different selection programs and training programs. And so I tell the command, I just say, you need to trust your cadre, because they're clearly picking people who look like the stress-hardy animals that we've seen in the lab. And they don't even know what the hormone data are that I'm measuring, or the psychophysiology data. They don't get to see any of that. So they see it. They are objectively assessing people's performance based on their experience about what they know will and won't work for them if they want a guy on a team and they're going to be downrange with them. I think that the cadres members that I've met, they're very thoughtful and mature individuals. And I always tell the command, you should trust them, because it's cheaper to trust them than it is to measure all these hormones.
Right.
So, I think you are correct. We do wonder with some of our data, who are we picking who might be successful? That's there's a slight mismatch between who they didn't think, would make it. So we often make it a game of, let's predict, who might, put the names in a hat and see who's going to be here at the end. And we are interested in those mismatches. Which ones do we miss with physiology and neuro, when we're looking at neuropeptide wire, DHEA, or threat attention bias? And they're often interested in who they got surprised by, who they didn't think was going to make it early on, but the guy who makes it, or the guy who drops, and they were sure he was going to keep going. And I think that's what makes both the research fun and being a human being fun. You can see people who may not have they haven't brought to the table the same genetic or neurobiological advantages as another person, but they want it more than maybe the person who has this biological advantage but just didn't try as hard on that day or for those days in a row. So there still is that elusive element of, a person and their determination and what they want. Something from their own psychological makeup. And so the cadre gets surprised, I get surprised, and I find that rather rewarding. But in the end, I do tell the commands, I said, you have a great group of cadre. These are professionals, and we need to trust them, because they're the ground truth outcome thing that I'm aiming for when I do my research. And as I say, we just keep finding that it supports what they say they're looking for. They may not articulate it in the same way. They may say, I just see it in the guy's eyes, or I see this. And sometimes I don't know how to translate that. But at the end of the day, when they say, this guy has it, this guy doesn't, there's a really high degree of overlap between who we're predicting from the baseline and the neurochemical data, and then who they pick. And it's just much cheaper to go with them. I mean, I might, it might be true that in the future, the government may decide for different units, just like they say, you have to be able to run so fast, you have to be able to ruck so far, you have to be able to carry so much weight, that they may want to do pre-screening and say, we want everybody who has a threat attention bias capability of this, or an NPY capacity of this. Those may be data points to see how many people you can bring to the table who we know have factors that contribute to success, and then let it ride. But, selection is selection. Not everybody nobody's selection program should have everybody graduate, or it's not selection. So, I think some of these data can help us understand maybe what brings people to the table and offers them an advantage. But it's still that sorting out that happens when you get a bunch of guys together, and now soon to be women in the clubs as well, to see how they perform together and sort each other out in these selection environments. But at the end of the day, I do trust the cadre. I've really learned so much from them over the years. I couldn't have done any of this work without them. They, in fact, helped me design my early studies at SEER School. I would tell them, so I'm this laboratory research guy, this professor from Yale. I come and I talk to you and I say, here's what I'm interested in. But if you were in my shoes and you had to get at these core ideas when a person is not thinking clearly, or when they are, or when they're anxious, and I went down a whole list of things. I said, when would you assess them in your program? And I kind of worked with them like a little anthropologist for 6 months before I did my first study where we actually assessed hormones. And we did these mini samplings, time points to set up the whole study. So I think much of the success that I've had, because I've been very lucky. I mean, many of the findings, that we've had from very early on have simply been replicated over and over and over again. And I really chalk that up to a good design and being lucky enough to work with, really smart professionals. I mean, I know something about hormones. They know something about their profession. And so I'm really quite grateful for that. I think that makes for really good science.
Yeah. I mean, it reinforces the idea that when you're trying to dissect these complex processes, you just need, it's got to be multidisciplinary. There's no one field or one person or one construct that can provide all the answers. And to be clear, it's not like in these selection courses, the cadre members get in a room and look at a picture of somebody and say yay or nay. There's still objective standards that people have to meet to pass the course, which I guess sort of begs the question, are we using the right standards? And when it comes to these SAS selection courses, the standards tend to revolve around physical things like how many push-ups and pull-ups can you do, how fast can you run a certain distance with or without a pack, and swim. And so basically, like I said, because you can't shoot at people in these selection courses, they're using general stress. So like physical hardship, sleep deprivation, food deprivation as a proxy for the actual thing they're trying to simulate. And I don't have the answer to this, but I get to ask you, which is the fun part of being the host. I guess my question is, sometimes I wonder if, for example, like Hell Week at Buds, does it have to be 5 days? Because if it's 5 days, now you're putting people's bodies through unnecessary hardship that might even could impact their careers potentially, when like maybe, if it was 2 days, you could still select people the right way, but you'd get more return on investment because you're not breaking people down. So I guess the question is, how much do we have to break people down physically to induce enough stress to see how people react in these scenarios? In other words, are we overemphasizing the physical, or do you think that because we don't have any more direct ways of measuring these qualities, objective ways, this is still, I guess, the right way of going about it?
Well, we're going to find out. I think that it's the challenge for the military as women enter into combat roles is we're going to hear about this debate about which kinds of physical demands in selection programs are there because they are definitely and concretely linked to tasks a person's going to have to do downrange, and which of the physical demands have been in the selection programs, because they're mainly programs designed by men and for men, really serve the function of weeding out people who would just give up. Right? They're tired, they're miserable, they're sore, they just can't do one more pull up or one more sit up. Or just can't ruck anymore. And I think that's going to be the challenge for selection groups to sort out. I think that nobody wants to see standards change. You hear people saying that. But where I kind of annoy some of my colleagues is I say, but right now you don't know which ones are exactly linked to downrange behavior. So, for example, when we were down at dive school and I watched them make people doing duck walking and some guys were blowing their knees and, they finally decided that's not really good. We don't have to make people do that to discover if they're going to be a good combat diver. There may be tasks that are in some of these programs that really they're not relevant to what you're going to do downrange, but they may serve a function of testing how much, I hate to use the term because it's poorly defined, but how much grit somebody has, right? How
Absolutely,
much determination and perseverance. And I don't know where that line is, but I think that is going to have to be a really meaningful, a really thoughtful conversation, because a lot of people get polarized really quickly and they go, no, everybody has to be able to do this task because I did it.
Yeah.
And we get the same dilemma in medicine. We have people arguing over, do you have to be able to be on call all night? So we know that keeping doctors up all night makes them think more poorly. We make more mistakes when we haven't had sleep. And yet you'll say, well, I had to stay up all night when I was an intern and learn how to think on my feet. Everybody needs to do that. So, but if you look at the raw data, it's like, if you're a patient, you do not want a doctor who's had no sleep working on you. But we all feel really strongly that being on call is a really important thing in our profession. So I think in the same way, the military is going to have to struggle with that, because I think as women enter, there's going to be some women who can do very nearly all the physical things that, most of the guys can do. They're going to beat some of the men in some of the tasks. But for selection, I think there's going to be certain things that men just have an advantage to. And it would be bad. I think in my view, it would be unhelpful. It would be bad. It would be the wrong way to go if we're keeping hurdles in selection that are simply testing a physical performance aspect that caters to men, that's not linked to something downrange. But if it's a task that's tapping into your psychological drive and perseverance, a task for a man may be slightly different than a task for a woman, but both tasks have to challenge the individual to tempt them to give up. Right? And you want to see the person who doesn't want to give up and will keep trying, even though they're being bested by something or it seems unsolvable. I think as long as people understand that there are some physical things that are a proxy for a psychological function, then they're always in a better position to design selection. I've seen some people make the mistake of thinking that the physical task was the predictor. One guy told me hand grip was a predictor of selection. No, it's probably the guy who's, driving himself to work out better, and he's got a high degree of self-discipline and motivation, and so he ends up being in shape. I think of that as the physical, the PT stuff, and when people are exercising on their own and following their workout agenda, they're self-driven, they're self-motivated, they don't need someone telling them else, it's time for you to go to work out, or are you on your schedule? And a side effect of that is their physical performance, but it's tapping into that conscientiousness drive, that they have a high degree of self-achievement and self-discipline, and they're able to delay gratification to achieve a goal. And I think that's why we see this link sometimes between the psych factor and the physical fitness factor. That kind of makes sense?
Yeah, it totally does. I think you hit on the key thing, which is that, there's never been I'm not going to say never, but rarely do people in the military have to go on missions where they haven't slept for 5 days. That's why you have things like crew rest, and we recognize that you're not able to perform optimally when you haven't slept in 5 days, but they're using these physical tasks as a proxy, perhaps for things that someone like you can measure more directly in terms of low neuroticism, focus, teamwork, that kind of problem-solving ability. So, and again, using that physical hardship is a way to test for those psychological characteristics. But I think when people get emotionally invested in the physical task for the sake of doing the physical task, where it probably doesn't matter if you can do 20 pull-ups, but if it's indicative of someone who cares enough about making it through selection that they did a lot of pull-ups and trained diligently prior to going to the selection course, now it's really reflecting more of a psychological trait than a physical one. So again, it's hard to differentiate these things. And I think you also made a really important point about we have to figure out where that line is. And that's where the conversation has to be had, because, no one's got that figured out. It's not a perfect process. And that line should continually evolve as we get more and more knowledgeable about this stuff. But I mean, obviously it's very fascinating, and we're not going to resolve this in the 1 hour that we have. Now, in closing, I wanted to talk a little bit about the cost of, so you mentioned that people in these soft populations are lauded for their emotional control, and even in the world of sport and in business, it's like, how can we make our people more like military special operators, where they have this kind of emotional control? And even in my military career, when I look back on it, I'm like, I was doing things a lot of times in training on a very routine basis that were really dangerous, and I thought nothing of it. And I'm wondering if there's, and you kind of alluded to this earlier, is there a cost of having, or what's the downside of having so much emotional control that, you know, when you've got a day free fall parachute jump in training, you don't even really get that much of a stress response? I think that it's obviously favorable for a lot of the situations that these people are going to encounter in their job, but how does it affect these people as human beings when they come home? And I guess the other sort of, you know, caveat to that is, do you think that even though we're selecting these people for these psychological traits, even people in the soft population get PTSD and they break down? Are we riding some of these people too hard?
Wow, yeah. So a number of things. What I would say with respect to sort of the regulation of emotions, and, you know, when we think about the business world and other worlds, the one area we didn't quite touch on is that people have a different problem-solving style, and in the soft community, we think of it as a problem-solving style of thinking on the move, thinking on your feet, adapting as you go, which is very different than a problem-solving style for someone who's an analyst. So when we talk about regulating emotions, I mean, I work at a university. I've got colleagues who are brilliant and as touchy and finicky, and it's like they're like hugging a porcupine. They're really difficult to be around. They do brilliant work, right? So they're thin-skinned and everything, but they're really smart and their ideas are good. So this is where I talk about fitness, where I think that in the business world, you could make an argument, well, depending on what your role is, not showing everything you think is probably a good idea, so you don't offend the potential buyer or customer or something. But if you're in some other department where you don't have to deal with people, you might be a little more thin-skinned. You might be a little more ruminative and obsessive. So I think there's this gets to the idea of in the job world you're looking at, what's necessary, what's needed to be able to do. Are you supposed to be problem solving on the fly, or do you actually have time to mull over something like you would if you were a good intelligence analyst or a mathematician working out something, you know, or a rocket scientist? You need time. You may find that the ability to regulate emotions doesn't take as high of a priority because you're not in such a tight teamwork environment. So playing well with other people is really important if you're on a soft team. But if you're an intelligence analyst or you're over at the NSA, you might get to hide in the corner, not talk to anybody, right? So people may not know how thick or thin your skin is. So that's why I just say, with that caveat, I think people have to be cautious about just translating it from one environment to the other. But with respect to the soft guys and this low neuroticism, it does have an Achilles heel to it, and that can happen in the interpersonal relationships at home, sometimes with their spouse. I mean, who knows why? There's a joke in the soft community is that you can't be there unless you've been married 3 times. It's not entirely true, but there's enough times people can say, well, I got married really young and I deployed so much, and my spouse found somebody else or it didn't work out. So there's a number of factors as to why they may joke about the longevity of relationships. But I think that in the relationships, what's been really typical for the soft guys, I've actually had to be a psych for, because I do operational psych for some units, is since they tend to view everything as thinking through logically and saying, my feelings don't matter, it can create certain kinds of frictions. They usually, for the life of the party, have married someone who's a lot more fun and hysterical, who wears their emotions much more on their sleeves. So it's the life of the party. And some of the tension that can happen in those relationships is one's running by logic and the other one's accusing them of not caring about feelings and how they feel. But when it comes to therapy, the challenge for a lot of these guys that I've worked with, some of whom who've had some very terrible combat experiences and needed to come to psychotherapy, is that they're so used to saying, I can fix this. Okay, what do I need to do to fix this? It's very frustrating to take that slowly in therapy, to just sit with unpleasant feelings. So I'll give you a quick example. One fellow I worked with, it wasn't a combat-related trauma. He'd had a sudden death in the family of his 19-year-old daughter. She had an unfortunate accident and died, and he came back home from overseas, and I was asked to see him because he had complained of having too big of a temper overseas, so he was brought back. And I remember when I spoke to him, he told me everything that happened. He cried for a few minutes and then said, wow, I haven't cried since I was 5. So now what do we do? And I said, well, it's going to take some time, but this is a start. And it was a really steep learning curve early on to discover you couldn't fix an emotional loss in the same way that you can respond, adapt, and fix changing problem sets in the battle space. And so I think one of the side effects, and this can happen to anybody who's really super low in neuroticism and runs their world by logic. Emotions are messy when we have loss, and I think that that's a challenge in doing therapy. And so I tell my fellow therapists who are going to work with guys, I say it's important to find things like sometimes cognitive behavioral therapy is responded to much more favorably because there's homework to do, there's writing tasks, there's something they can do. But it definitely doesn't play to their strength to have to sit with unpleasant emotion and just experience it as a human being, because very much of the time, I think that's the challenge. When any of us has had a loss, is it sucks. There's nothing you can do. You're going to miss that person maybe for the rest of your life. You can't make that go away, but you're always tempted to distract yourself by saying, well, what could I have done differently? Maybe if I had done this, they wouldn't have died. And they run through all the problem solving sets, even though they know logically there's nothing they could have done that would have saved that individual. So I think there's a downside to being too low in neuroticism and never having to work with emotions. There's a downside to being way too high. But people who are way too high keep my profession in business. So, but those are my thoughts, I think, about that. I hope that made sense. Yeah, you had me.
No, it made total sense. I mean, it was so thoughtful and so fascinating, and it speaks to that very fine line between sort of elite performance and pathology. And a lot of times, what makes people elite performers, they walk a very fine line where that can cross into pathology, and you see it physically too. I mean, even if you're talking about biomechanically, if you're looking at like a starting Major League Baseball pitcher, if you had someone who wasn't a starting pitcher and you measured the range of motion in the shoulder, you might think, wow, this guy's like crazy. He's got too much laxity and possibly, labral tears and joint pathology. But a lot of times that joint pathology is what allows him to throw hard and those adaptations. But again, if they walk that very fine line where if they cross that line, now they're injured and they compromise themselves structurally. And we're seeing the same thing psychologically with people in the military. And again, it's having a conversation about where that line is what's going to advance all these professions forward. Yeah.
It's so funny because we do think of ourselves as different than all the other animals, right? But it wouldn't surprise you to say a plow horse or a quarter horse is different than a thoroughbred at the racetrack. And, one is really good at one thing, like at the rodeo or pulling a plow, and the other one's really good at just running down a track, and it's terrible, if they break their ankle, they almost have to shoot them. But they've been selected for different breeds have been selected for different tasks.
Yeah.
And it always amazes me that we don't want to think of ourselves as like the other animals. But I think of selection programs in that same way, like you think of different breeds of dogs, different breeds of horses. They've been differentially sort of selected for different tasks. And I don't think anyone's better than the other, but it's really good at what you want them to do. Racehorse is really good at running down a track if you say, I need it to go fast, And if you need a dog to help you hunt, there's some dogs you don't want and there's other dogs you really want. And I tend to think of us like that, because I'm a dog person. So I think some dogs are highly neurotic and others are not,
Yeah, right. And then it's how do we breed all these dogs or humans and then still hold on to what makes us fundamentally human, which is, I mean, we're at the end here, but that's another fascinating question, maybe for another time. Where can people learn more about your work and your research? Are there any like websites or social media resources that you use?
I'm going to have to get better at social media. They can come to the website either at Yale or the University of New Haven. Everything we've published is in peer-reviewed journals. So if they like to look things up, and they'll be in the American Journal of Psychiatry or the International Journal of Law and Psychiatry or Biological Psychiatry or Psychosomatic Medicine or Military Medicine, or they're welcome to come and send an email, and I'm happy to steer them. And I need to get better at the social media access, but we're happy to provide any papers or any data that people would like.
All right, I'll post the links to those websites in the show notes. Well, thanks so much for your time again, and you've given me more questions than answers, which is the whole point of this. I've got a lot to think about, but thank you so much. You've been really generous and thoughtful with everything.
Thank you. I really appreciate it.
All right, take care.